Recently, there's been a lot of criticism and attacks on homeopathy by various individuals, and these have been very much in the media, in the newspapers, on television, on radio, and it reached a culmination recently when a group of MPs submitted a report to the government suggesting that homeopathy shouldn't be available on the National Health Service and GPs shouldn't be allowed to prescribe homeopathic remedies. This was a report by the so-called Science and Technology Committee of the House of Commons, comprising a small group of MPs, very small, about 4 or 5 I think, and who interviewed various experts, many of them known skeptics and detractors of homeopathy, but also Dr. Peter Fisher and others who supported the use of homeopathy on the National Health Service. Now, what the critics claim, the skeptics of homeopathy claim, is that there have been many trials of homeopathy and none of them have shown that homeopathy is superior to placebo. None of them have shown this. And thus, homeopathy is a placebo response, and we shouldn't prescribe placebos on the National Health Service. The National Health Service is not here to prescribe placebos for patients. Medicines that only work because the patient thinks they're going to work, and therefore that is their mechanism of action. Now, homeopaths, or the homeopathic consultants, physicians, feel that the trials that have been done do show that a homeopathic medicine has an effect. They do show that a homeopathic medicine has an effect over and above placebo, but this is disputed. This is a dispute that the detractors of homeopathic medicine say no, the homeopaths say yes, homeopathy works, independent of placebo. But what nobody is disputing is that patients who visit homeopathic doctors go through the homeopathic process of talking to a doctor who attempts to understand you fully, not only your disease and your symptoms, but understand how you cope with your disease, what psychological reactions and emotions emerge in you as a result of the disease, what sort of person you are, what sort of foods you like, your exercise, tremendous detail. Go through this process and then prescribe a medicine based on all this detail, and the doctors fully believe that this medicine, homeopathic doctors fully believe that if this medicine matches you in the totality of your symptoms and character traits and physiognomy, if it matches you, it can stimulate you to heal certain illnesses in your body. This is what homeopaths believe. The detractors believe it's all placebo. It's all placebo, and that and they say when doctors, homeopathic doctors, try to explain to them what I've just said, the whole homeopathic process, talking to a patient, listening to the patient, prescribing a medicine which the homeopathic doctor firmly believes is going to have a specific action on the individual, people get better. They say absolutely not, it's placebo, but they admit that the patients do get better. And they say, so someone might say to the detractors of homeopathy, so what's wrong with that? What's wrong? What's wrong if the patients are getting better? They go to a doctor who listens to them very carefully, has a wonderful bedside manner, and then gives a remedy which you believe is placebo, which the doctor believes is a medicine, but you believe is placebo, but the patients are getting better. And in fact, there are many trials, particularly one at the Bristol Homeopathic Hospitals, that shows a 70% satisfaction rate of patients visiting the Bristol Homeopathic Hospital. That's a wonderful statistic, because these patients largely comprise people who have not been able to have been helped by their GPs. So their GPs, being reasonable men and women, have thought, well, look, I haven't been able to help him. There's no harm in me sending these patients to other medically qualified, fully accountable doctors happening to specialize in homeopathy, working at NHS homeopathic hospitals, to see what they can do. It's safe enough. And so they send them to these difficult to heal cases, to these doctors, and these patients report a 70% satisfaction rate, which is wonderful, a wonderful result. So now, what do the detractors of homeopathy have to say about this? They say the following, and this came out in this report, in the report of the Science and Technology Committee appointed by the House of Commons, these 4 or 5 MPs wrote, "This is unacceptable because doctors are misleading their patients. Homeopathic doctors are misleading their patients. For them to be true and authentic and honest with their patients, they would have to tell the patient, this is a placebo I'm giving you." Have you heard of anything as ridiculous as this? First of all, even if these doctors knew they were using a placebo, the placebo is not going to work if you say to the patient, "I am giving you a placebo." But that isn't even the point. The point is that homeopathic doctors do not accept that homeopathic remedies and medicines are placebos. They would not spend years and decades of their lives studying the intricate drug pictures of homeopathic remedies. It's a huge task to learn and study homeopathy, as any homeopath or homeopathic doctor will tell you. They would not need to do that at all. They could just give blank pills if they wanted, if they thought it was placebo. I have been to many conferences all over the world, and I have yet to meet a doctor who thinks that he's giving placebo to patients, calling it homeopathic remedies, and just getting patients better with placebo. This part of the report, I think it's paragraph 93 of the Science and Technology Committee's report on homeopathy and the NHS, that talks about the doctor-patient, the integrity of the doctor-patient relationship. What is written there is deeply disingenuous in my mind. It accuses homeopaths of misleading their patients, but they are not misleading their patients. They are not charlatans. Homeopaths believe that the medicines that they use are capable of stimulating people to get better, stimulating the inherent healing ability of a human being. No matter what their critics believe. Their critics may believe something else. The critics may believe it's the bedside manner, it's the kind doctor, it's the time the homeopath spends, it's the hypnosis that the homeopathic doctor... They can believe all that if they want to. But even the critics of homeopathy do not deny that patients going through this homeopathic process do get better. They don't like how they get better. They say it's a placebo response, and that's misleading the public. Now, a doctor asked a very interesting question on the comment section on my website, and asked the question, how would the NHS want to get those people better that get better on homeopathy? What do they do? What do ordinary doctors do to get people better by this placebo response? The answer is nothing. They don't have a method of getting people better by suggestion or hypnosis or anything else. They don't have a method. So even in their model, which I don't agree with, I don't agree that patients get better homeopathy only from a placebo response. I absolutely don't agree. But even if they thought that, that isn't a reason to ban homeopathy. Homeopathic doctors have been used by patients in this country at all levels of society for 200 years. From the Queen to all sorts of individuals all over this country have used this form of medicine and benefited from it. It should be left alone, and this interference by trying to prevent... What is really disturbing about this is that this Science and Technology Committee and people are calling for homeopathy to be removed from the NHS, as if patients can demand homeopathic treatment. I can say, I want homeopathic treatment and you have to give it to me. Absolute nonsense. Patients do not say, I want surgery and you have to give it to me. I want drugs. Doctors have to make informed decisions. What these critics and skeptics of homeopathy want to do is to prevent or thwart fully qualified doctors from sending or referring patients to other fully qualified doctors who happen to use homeopathic medicine. It is an absolute disgrace. This report by the Science and Technology Committee should be kicked into touch by the government and treated with the contempt that it fully deserves.